Now, the first type of drugs for constipation is bulk forming. As I already told, we know that this gut has to have a soft quality, soft, fluffy, good volume, and good quality stool. Then only this stool can be passed very easily from the gut to the sigmoid to the rectum and outside the anus. So, to form a good quality stool, bulky stool, soft stool, we must have a bulk forming agent in those patients who are not able to form a good bulk, so that we can use the dietary fibers, because I have told this several times that the fibers don't get absorbed in the blood, they stay in the gut itself and they form the bulk. So we can very commonly use bran, psyllium, isabgol, or isabgol powder, methyl cellulose powder. These all things come into the fibers. Around 5 to 15 gram of such powder can be used on a daily basis, especially at night. And this has to be actually dissolved into lukewarm or normal water in around 100 to 150 ml. And this bulk forming powder is very commonly seen in a commercial preparation of soft wag. So these dietary fibers also we can use, which is very commonly seen with the staple food like rice, wheat, and all the other staple food that we use very commonly. Vegetables, fruits, they have huge quantity of these fibers, which actually helps to form a good quality stool. That is the reason why we always advise the patient to take plenty of vegetable with large leaves. The large leaves fruits, they very commonly have high quality of fibers, and they form a good bulk stool, so that it can be easily used to treat the constipation. Now, what they do is these fibers absorb water in the intestine, so say they get swelled up and they increase the water content of the feces, so they automatically soften the stool and it facilitates the colonic transit. Softer is the stool, larger is the stool, it is very easily passed forward. Just imagine a stone in the gut. The stone won't move because it is not soft enough. But a soft, bulky stool is very easily propelled forward, and it is very easy to get that type of stool with the fibers. Now, these dietary fibers also very commonly supports the bacterial growth in the colon, which also increase the fecal mass, which is very much necessary. So that is the reason why these dietary fibers not only increase the stool volume, but they also promote the bacterial growth to increase the fecal mass. That is the reason why they increase the bulk of the stool for easier passage of the stool. So, the most important thing is we should always advise the patient to increase the intake of dietary fibers in the form of vegetables, fruits, staple food, plenty of water, and if it is possible, or if the patient is not able to take this type of food, then we should add bran, psyllium, or secul or methylcellulose powder in their diet, extra to their food. The full effect of these medicines actually requires daily intake, and it takes around at least 3 to 4 days for their good effect to see. So we ask the patients to take around 10 to 20 grams per day of this powder, dissolved into 100 to 300 ml of water, and we advise the patient to take this after the food, after the lunch or dinner. But these bulk forming drugs will not soften the stool which is already made or which is already present in the colon or rectum. And a very common problem of this bulk forming stool is flatulence. Gases is very commonly seen with this bulk forming drugs. So they may complain of bloating. We have to always remember this. And the most important thing is ki if the patient is taking this bulk forming agent, then definitely good amount of water has to be consumed with this bulk forming agent. That is the reason why we always give this powder form of 10 to 20 to 30 gram of this powder, of this bulk forming agents, with at least 100, 300, 200, 400 ml of water, so that this powder can swell up and can form a good quality soft bulky stool. Thank you.